To ensure generic drugs are as safe and effective as their brand name counterparts, they must demonstrate therapeutic equivalence. This means the generic must have the same active ingredient, strength, and provide the exact same clinical effect and safety profile in the body. The FDA rigorously evaluates generic drugs' stability data and absorption profiles to confirm this identical performance. Only after meeting these strict standards are they listed in the FDA's Orange Book, serving as the definitive guide to approved, therapeutically equivalent generic products. This diagram outlines the journey to determining if drug products are truly interchangeable. It starts by asking if they share the same active moiety. If so, they can be pharmaceutical equivalents, meaning identical active ingredients, strength, and dosage form. To be considered therapeutic equivalents, these pharmaceutical equivalents must also demonstrate the same clinical effect and safety profile in patients. The ultimate goal is an interchangeable drug product, signifying it meets all these stringent criteria for safe and effective substitution, particularly relevant for generic medications. Bioavailability defines the rate and extent to which an active drug becomes available in the systemic circulation to exert its intended effect. When a drug is taken orally, it first passes through the liver, our first-pass filter, where a significant portion can be metabolized and cleared before reaching general circulation. In contrast, intravenous administration completely bypasses this initial liver metabolism, resulting in 100% bioavailability, represented as F equals 1. Therefore, F quantifies the actual fraction of the administered drug that successfully makes it into the bloodstream intact and ready to act. This plasma-level time curve is fundamental to understanding how drugs behave in the body. It illustrates drug concentration in the plasma over time after administration. Cmax represents the peak concentration, indicating maximum drug effect and potential toxicity. Tmax is the time taken to reach this peak, reflecting the drug's absorption rate. The area under the curve, or AUC, quantifies the total drug exposure, which is a key measure of bioavailability, how much active drug reaches systemic circulation. This slide illustrates two fundamental ways drug dose influences drug concentration in the body over time. In linear kinetics, the total drug exposure, measured by the area under the curve, AUC, increases directly in proportion to the administered dose. For instance, doubling the dose doubles the AUC. However, with saturable metabolism, the body's drug elimination pathways become overwhelmed or saturated at higher doses. This results in a disproportionate and much larger increase in plasma concentration and AUC than expected, significantly raising the risk of potentially toxic drug levels. Understanding these differences is crucial for safe and effective drug dosing. This method assesses drug bioavailability by analyzing the amount of unchanged drug excreted in urine, primarily used when a significant portion is eliminated via the kidneys. By meticulously collecting all urine and determining the total cumulative amount excreted, due infinity, we directly measure the fraction of the administered dose that reached systemic circulation. The rate of excretion, due du dt, often mirrors the plasma concentration curve, providing insights into the drug's elimination kinetics over time. Therefore, due infinity offers a robust and direct measure of a drug's true systemic exposure and bioavailability.